Congress is working on a physician fee fix that works for all healthcare providers. By what date does CMS need a Medicare bill signed into law to ensure physicians receive the proper payments on July 1st?
In order for us to be able to work with our contractors to get all the programs put in place, probably mid-June would give us ample time and ready to go on July 1 for a seamless transition so there'd be no interruption in payments.
And can you talk to us about what step has CMS taken to prepare for either a reduction or the possibility of a congressional change to the formula?
We will certainly be working very close with Congress to make sure that if there is a reduction, it is hardwired into the system now, and that would go forward. If there is a change by Congress, we would hopefully be able to anticipate that again to make it as seamless transition as possible. So either way, we hope to be prepared and to implement the law as Congress determines for us to implement it.
Okay. The Medicare Economic Index is the government's measure of increases in physician practice costs. Most importantly, this index serves as CMS starting point for each year's physician payment update. Unfortunately, the way that MEI is calculated has not changed in nearly 35 years. Is there any reason why CMS hasn't attempted to reevaluate the MEI and bring it to the 21st century?
It's a good question. And our Office of the Actuary and our head actuary, Rick Foster, has looked at the Medicare Economic Index, or the MEI, on a regular basis, and they believe that continues to be a good indicator for growth in this area at this time. If there's new information that they can be looking at and new information the physician community, others can bring forward.
Who is that person?
Rick Foster, our actuary.
So Mr. Foster really believes that the way healthcare practices operate today is not different from how healthcare practices were operated 35 years ago?
No, I don't think I would characterize it that way, Madam Chair. I think it's rather in terms of it as a reasonable proxy for determining the inflation increase. But I would absolutely agree with you. The practices have changed over time, and as a result of that, through the RBRVS system and through the American Medical Association's Relative Value Update Committee, also known as the RUC, in terms of trying to get the values between physician work, physician practice expense, and ultimately malpractice.
Does the physician community agree with you on that assessment?
On the MEI, perhaps maybe they do not.
Why is that?
But they may think that there's other inputs that ought to be considered as part of the process.
And CMS believes that there's no other input that should be considered.
I don't believe that we've seen any evidence in terms of new survey information that would indicate that that would be changed at this time.
So you're telling me that the way medicine is practiced today is not very different from how medicine was practiced 35 years ago?
No, I don't.
And that the cost that a person, a medical practitioner incurs today in terms of new technology, and you want to link healthcare, quality healthcare, to new technology, IT, and so on. So none of that.
Well, I think there's two parts of this puzzle. One is the MEI, which is the inflation update. The real work is done with the RBRVS system and the relative value updates that are evaluated by the RUC, the Relative Value Update Committee of the American Medical Association. That's where the real activity is in terms of what payments are out there in terms of new technology, the work that physicians put in terms of the services. Those are changed on a regular basis, and what we did actually in 2006, we did a 5-year review. The statute requires for us every 5 years to review the codes, to work with the AMA and other physician specialties to do that. They made a number of substantial changes to that, and we accepted all of those. So it is as accurate as we can possibly be for this time for the real activity for the payment schedule. In terms of the inflationary update, that I think the factors that go into that continue to be consistent, but on the rates that are paid are as accurate as they could possibly be.
Well, I just can't buy that Medicare Economic Index for the last 35 years has been unchanged. It doesn't make sense to me.
If there is new information that our actuary to be looking at, would be interested to see that.
Okay. Mr. Kuhn, CMS has stated that Medicare spending on physician services is out of control, in part due to rapid utilization. However, the 2008 Medicare Trustees Report indicates just the opposite. According to that report, the annual growth in the volume of Medicare physician services for 2005 and 2006 was just 3.6%, which is only about half the growth rate projected in their 2006 report. Is the administration's position on physician fee payments reflected of MedPAC's finding?
What we saw between about 2002 to about 2005, 2006, double-digit increases in physician payment. And it has begun to level off this last report in terms of the volume of services that are out there. But it's still growing at rates that are much greater than other parts of the Medicare program, and certainly growing at rates that are far higher than overall inflation. So it continues to be a cause of concern for us as well as MedPAC.
But let me ask you again, sir, is the administration's position on physician fee payments reflective of MedPAC's findings?
I think well, I guess it would be, I need to know specifically what MedPAC's findings were on that. If you could restate that then, please.
I'm sorry?
What specifically was MedPAC's findings?
Well, according to that report, the annual growth in the volume of Medicare physician services for 2005 and 2006 was just 3.6%, which is only about half the growth rate projected in their 2006 report. So you're talking about, this out of control, yet the MedPAC's finding doesn't reflect it.
I would need to check with our actuary to see if the recent information in the trustees report, the Medicare trustees report, matches up with MedPAC's
so
findings.
Let me ask you this question. Is CMS willing to refine its position on the physician fee issue if utilization drops?
I would think that where we are right now in terms of trying to change the way we pay physicians is not the debate that is before us. I think the real issue before us is how we go about making those changes. I think everybody within organized medicine, certainly most in Congress, believe that it is time to have a change in the way we pay, to start paying for value, not volume of services. So even if we're seeing lower growth rates over the last couple of years, I don't think that should stop us or deter us from trying to find a better way to get better value and better quality in terms of our healthcare system.
I don't think that no one here is saying the opposite. The problem is when you say that we need to attract more primary doctors to serve the senior community that is growing. And as Mr. Buchanan pointed out to you, the problem is that incentives are not there for these people to come and serve those community. And so you need to take into account the new economic reality of the new physicians and the type of incentives that you're providing to attract those physicians to enroll into the Medicare CMS services.
I would agree with your statement there that we do need to make sure that this program, this particular physician fee schedule continues to evolve, and I think it has over the last several years as we move forward. And particularly on the issue of primary care physicians, again in 2006 when we did the 5-year review, the RUC came forward with an extraordinary recommendation in order to change values for what we call E&M codes, evaluation and management codes, which are primarily the codes used by primary care physicians. It's the time that physicians spend with patients, we're mostly in primary care. Many of those codes went up 20, 30%. We accepted all those. And so we are working hand in glove with the physician community to try to make those changes and make them as accurately as we possibly can.
Okay. I have other questions, and I will come back in the second round. Mr. Shabbat.